Hey guys, welcome to the first of our 12-month series where each month we're going to be going over a new health-related topic. And this month specifically, we're going to go over low back pain. And in this video, we're going to go over how low back pain is often treated in the medical community. When people have a health-related issue, symptom, problem, they're often hesitant. They don't really know how the medical community or how different healthcare providers are going to treat that, so they don't know who to go to. So we did our research to let you in on the most common ways that the medical community will treat low back pain. Low back pain is super common. First and foremost, it's the leading cause of disability worldwide. It's one of the leading causes of missing work. And it's also the second most common symptom-related reason for seeking care from your primary care physician. Not only that, but it's also very expensive. It's costing the U.S. $100 billion a year in lost productivity at work and also healthcare expenses. So it's pretty obvious that this is a very common issue, and it's very important that we know how to treat it effectively and safely. So the medical community, the number one way that they will treat low back pain is like pharmacologically, meaning with drugs. The number one drug that they'll recommend will be NSAIDs. NSAIDs are anti-inflammatory, meaning they fight inflammation. So inflammation, by the way, it's a natural process that happens in the body when an area is hurt or it's injured. So when there's tissue damage in the low back, there's going to be this inflammation process that the body will naturally do, which will help to heal the tissue, but the tissue needs to be protected. So the body will, inflammation will have these chemicals that will be released and tell all the nerves in that area to send signals to the brain that, hey, it'll be pain signals, and the brain's gonna tell that your body to not move that area, to aggravate it anymore, so that the healing can happen. So when you take an NSAID, that inflammation is going to come down, and so those signals are no longer going to be, those pain signals are no longer going to be in the body. So there's actually a higher risk that we're going to further irritate the tissue even more by not having that pain there anymore. So it'd be much more efficient to do that, to take care of the low back pain in a more natural way and still allow that inflammation to happen. Not to mention that NSAIDs also have a lot of common side effects. Most common will be like gastrointestinal irritation, things like gastric ulcers and gastric bleeding. So another way that low back pain will be treated will be in the medical community will be through something called reassurance. Now reassurance, when that happens, it's going to be like the doctor will do an initial exam, and during that exam, if there's nothing that's really thrown up any red flags, there's just not really too sure what's going on with it, but they don't think it's anything serious, then what they'll do is they'll do reassurance, which will be, they'll tell the patient, hey, I don't think anything is super serious going on here. It'll go away on its own. You can just go home, try to rest it, ice it, maybe do a little bit of stretching, and they think it'll go away on its own. But we know that is if the actual cause of the issue is not addressed, and we just kind of guess and we just tell them to go rest, we know that issues will very often just come right back, unless the cause of the issue is actually addressed. Another way that the medical community often treats low back pain is through something more invasive like surgery or injections. And we know that surgery, especially low back surgery, does not have a very high success rate. We have several patients that they've come to the chiropractor as a last resort. They've already had low back surgery, and it did not work. They were in a tremendous amount of pain before the surgery. They had the surgery, which is very expensive, and they might have felt a little bit better after, but then once the drugs wore off, they were actually in more pain after the surgery than they were before the surgery. So low back pain is surgery for low back pain is very risky, and we want to make sure that we're having a very educated decision when we're making our choices of who to go to and what procedures to undergo. So next week, what we're going to be going over is how we in our office treat our patients with low back pain and how we're able to get awesome results naturally and effectively. So I hope you guys enjoyed this video, and be sure to stay tuned next week.